watching Good Morning Hawaii.
Well, aloha, Good Morning Hawaii. Welcome back. It's 6:25 here, and I'm sitting here with Dr. Diana Joy Ostroff to talk a little bit about sugar and the effects of sugar on our keiki. Doctor, thank you for coming in today.
Nice to meet you.
It's nice to meet you
thank
too.
you,
So Halloween, just a week or so ago, we were out there, and the whole point is to collect bags and bags of candy.
And the more the better.
The more the better, right? I mean, I remember this holiday. I look back on that with fond memories. But of course, the effects of that are that now the kids are eating candy for days afterwards.
And weeks and months and pretty much throughout the year, if it lasts.
If it lasts. So, well, let's start first of all by your background. You're a naturopath and a pediatrician. Tell me about your background.
Well, I went to about 16 years of higher education, 10 years in alternative medical schools, and I've been in practice for 27 years. I focus on taking care of children and their parents in a way that's going to promote health without the use of medications that have chemical substances within. We use nutrition. We use herbal medicine and homeopathic medicine, physical modalities, lifestyle changes, and just help the person to be well and not dependent on chemicals.
Well, let's talk about chemicals. Let's talk about what we have in front of us here. Of course, we're talking about sugar. The Halloween candy is one of them. But these are common. These are year-round commonplace beverages. Every potluck in Hawaii has these. You were talking the surprising sugar content of these. We're going to go through that right now. So these particular beverages here, these have how much sugar in them?
So the Hawaiian Sun and the Aloha beverages have roughly 40 grams, 30 to 40 grams of sugar
and
per.
That's this
and
right
that's
here.
About this much sugar. Now the recommended dietary allowance supposedly is between 2 and 3.
All right, let's compare those there. Let's look at the piles of sugar. That's about
2 to 3 teaspoons, whereas one of these cans is 7.5 teaspoons, or almost 40 grams, and that's actually twice as much. Well, that actually
one of these is twice as much.
Well, it's way yes, but it increases the risk of developing diabetes by twice as much.
Just for having that.
Just by having
and
one.
we're going to go quickly here, but let's talk at this. This is a regular Coke out of the machine. Look at how much sugar that is compared to how much is your daily allowance.
A lot of sugar in the Coke, and not to mention the caffeine and the caramel colors.
Sure.
And then even pineapple juice, 2.5 cans.
Natural
and
juice.
A lot of times we think, well, we'll just give our kids juice, but even the juices have a lot of sugar, and it's having an effect on the pancreas. And there are a lot of diseases that are starting to stem, well, they're continuing to stem, but more and more with children, from overconsumption and overweight and obesity. And these are very important we want to alleviate even when children have asthma and allergies and hyperactivity, ADHD, and even the predisposition toward cardiovascular disease. It's starting to happen in children, and diabetes and cancers. Wow. So we're seeing more and more disease, and we're seeing more and more sugar being administered.
An easy solution: eliminate the sugars from your diets, and maybe encourage kids to drink a lot more water.
A lot more water.
Dr. Joy, thanks for coming in today. I appreciate having you here and appreciate the information. If you want more information on this, of course, you can visit our website, KITV.com. We've got more of today's headlines coming up for you in just a bit, right here on this Veterans Day. Stay with us.